Hello, I'm Jean, a volunteer with SHIBA, which stands for Statewide Health Insurance Benefits Advisors. We're a program of the Office of the Insurance Commissioner, and here on Whidbey Island, we are sponsored by Island Senior Resources, an agency that has a number of other wonderful programs that I'll be sharing with you before we end our program today. But for right now, we're going to get started talking about scams related to Medicare and COVID-19. We want to help everyone stay safe, to protect your medical information and your wallet as we learn ways to prevent, detect, and report scams that are related to COVID-19. I hope you find this helpful. If you have any questions, we will also be sharing information about contact resources at the end, and you are always welcome to contact the SHIBA program at Island Senior Resources. So now let's get started. As I mentioned a moment ago, SHIBA stands for the Statewide Health Insurance Benefits Advisors. We're a program of the Office of the Insurance Commissioner. Also part of the Office of the Insurance Commissioner is SMP for the Senior Medicare Patrol. Again, we are a free service. We work through Island Senior Resources here on Whidbey, and our mission is to provide unbiased and confidential information about Medicare and other health insurance. Washington State was a leader in developing the SHIBA model, and it's been replicated across the country to help Medicare beneficiaries understand their Medicare options. We rely on volunteers in local communities, people just like me, and you, if you would like to consider becoming a volunteer, we know we would love to speak with you. And again, our goal is to help others answer Medicare questions and keep them safe from fraud. There are some estimates that healthcare fraud might cost our country as much as 10% of our annual healthcare expenditures, or about $230 billion. So we really need to do all that we can to safeguard the healthcare system, the trust fund, and make sure that the money will be there as we need it in the future. There are dozens of types of scams and schemes that are particularly prevalent since COVID-19 began. We're going to look at some of those, and we will also be looking at those that we've been seeing for years, but sometimes have taken on a bit of a COVID sheen, we'll say. And I'm doing this taping mid-March, and so just be aware that there can be new schemes popping up all the time. We just always need to be cautious and protective of our information. According to the Federal Trade Commission, in the past year, they've received about 360,000 reports regarding COVID-19 scams, which have cost Americans more than $350 million. The median loss in the state of Washington per person who was scammed has been about $400. So let's do what we can to help keep our money safe. This slide warns us about ways that we need to protect our information and how we can be tricked by scammers who tell us that they are from the government, from respected medical organizations, and sometimes they pose as contact tracers. So here's what we need to share. Since the start of the coronavirus outbreak, scam artists have come out of the woodwork, and this frequently happens in cases of natural disasters, and coronavirus certainly falls into that category. So these imposters follow the headlines, and even as scientists and medical professionals work overtime to find ways to make us safe, to get a cure, these folks are working hard to use this as an opportunity to deceive us, steal money, or our sensitive information that they can sell on the dark web. Right now, scammers use the pandemic as an opportunity to perpetuate identity theft and to commit fraud in a variety of ways. So here are some tips. Be suspicious of claims related to COVID testing, to vaccines. Someone tells you that they can get something you can use at home, DNA testing, even selling things like durable medical equipment, braces, specialized thermometers, sanitizers, that sort of thing. Many of those have been found to be useless, and sometimes people pay for equipment that they never receive. There have also been reports about phony pop-up testing. People will set up a cover, some sort of a tent in a parking lot, and then everyone will drive through. They will share information about their health insurance numbers. Again, it turns out that they're fraudsters and they were just collecting information. Please to always check with your healthcare provider as an authoritative resource that you can trust. Many scammers will use pressure tactics. They'll tell you you have to act now or you're going to miss the opportunity. Or maybe you're required by law to share information. That sometimes happens with contact tracing, which we're going to talk about in a moment. But I do want to share that one of the worst sources, as reported by the Federal Trade Commission, are people who respond to what they see on social media. Always check with legitimate organizations. Never share your personal or financial information until you independently check out that contact. Washington State has implemented contact tracing, meaning you may be informed that you've been in contact with someone who has tested positive and who shared your name with the health department. Contact tracing concerns people who have been in contact with someone who tested positive. And when they say that you have been in contact, they mean within 6 feet or less for 15 minutes or more. It's not someone that you happen to pass on the street. It's you've been in contact for a significant period. Now, this chart from the state's coronavirus task force describes how contact tracing works. A person who has symptoms or who suspects he or she may have been exposed will be asked to quarantine. That's your number 1 on the chart, and then to get tested. Number 2. If the tests are positive, the individual is asked to isolate. Number 3, and number 4, to share information about others with whom he or she came into contact. If your name is shared, you would be advised of the situation, and then you would fall into this diagram for contact tracing. The important thing to know is this: if you are contacted by a legitimate contact tracer, you are never asked questions such as your social security number, a bank account, or credit card information. You will never be asked to pay anything related to the activity. The questions that may be asked are very simple and very few. Things like date of birth, ethnicity, and address. Scammers who engage in this type of imposter fraud pretend to be with the CDC or the health department, and they want to collect your data and your money. So again, you don't want to share too much information. You never want to give money. If you have questions about whether a contact you receive is legitimate, you can contact the state's coronavirus task force. And if you think you have been a victim of fraud related to COVID, we hope that you will also contact SHIBA. And we're going to be sharing those numbers shortly. As we just mentioned, scammers will leverage this COVID-19 pandemic to prey on unsuspecting people, and they will also use the vaccine. So here is what you need to be aware of. You will not need to pay anything to get tested. You do not need to pay for the vaccine. This is a public health emergency, and the government is picking up the cost. You cannot pay to put your name on a list or to get the vaccine. You cannot pay to get early access to the vaccine. No one from Medicare, the health department, a vaccine distribution center, a health insurance company will contact you and ask for your social security number, your credit card number, or bank account information. But be aware of this, that Medicare Part B covers the cost for people enrolled in Medicare. Whether you have original Medicare or a Medicare Advantage plan, Medicare Part B will pay. So when you arrive for the test or for a vaccine, you may need to show your Medicare card. Again, you cannot be charged for the test, you cannot be charged to administer a shot, but you can be asked to provide your Medicare number so that the medical facility that you are using will have an opportunity to bill the government for whatever test or vaccine you are receiving and for the administration of that. The number one complaint to the FTC over the past year has been related to online scams connected with COVID-19. So please check with your healthcare provider before you order or pay for any related products, such as the personal protective equipment, or PPE as we refer to it, such as face masks and hand sanitizers. Especially avoid items related to home testing kits, treatments, and miracle cures. It's become somewhat trendy recently to post information about COVID testing results and vaccine schedules on social media. Scammers can use this information, contact you with false requests. They can provide false reports and request your Medicare financial or other information. And because they have some tips from your social media posting, they will use that as the basis to get more from you. So we suggest, please be really cautious in what you post. Do not overshare. In addition to the COVID-specific scams that we've talked about until now, here is more that we look at year after year. It's constantly involved with Medicare fraud and abuse, and of course COVID is just folded into the mix. So as you see by the slide, the types of fraud and abuse that are really rampant are billing for services, supplies, and equipments that are not provided, billing for excessive medical supplies, obtaining or giving a Medicare number for free services. You sometimes see these on TV. You need to treat any offer of free services in exchange for your Medicare or healthcare information with caution. Improper coding can be used to obtain higher reimbursement. Sometimes it's a mistake, sometimes it's intentional. Unneeded or excessive x-rays and lab tests, claims for services that are not medically necessary, and using another person's Medicare number or letting someone use your number to obtain medical care supplies or equipment. And you need to be cautious about this, not only in terms of money lost, but also in terms of how that information then becomes part of your medical record, and it can really make things confusing. In addition to harming the Medicare program itself and raising the cost of business for all of us, Medicare fraud results in serious personal consequences for people who get caught in the middle. And these could be identity theft, negative health impacts, and other personal financial losses. So medical identity theft happens when someone uses your Medicare number. Not only do they waste taxpayer dollars, but if they get medical treatment, that sort of thing, it will then become mixed in with your medical record. There was a story some years back on 60 Minutes about a fellow who found that his Medicare number had been used by someone unknown to him with a different blood type and who obtained prosthetic legs. So you can imagine how confusing that's going to be when it's found in his medical records. So again, you want to keep an eye on it, make sure that you're protecting your Medicare and your health information. The health impact that is noted here. So you're receiving health care from a fraudulent provider can mean that the quality of your care is poor. Interventions and treatments are being provided that are not medically necessary, and sometimes they're even harmful. And personal financial losses. Well, fraud results, as I mentioned, in higher costs for beneficiaries, such as our co-payments. We want to make sure that you aren't stuck for bills from providers who should not have billed for care that you didn't really need, or sometimes they should have billed Medicare, but instead they billed you for the entire cost of the service. You may have seen that Washington State has many instances of fraudulent claims for employment benefits. So the state has paid out millions in benefits to fraudsters around the globe. And tragically, many individuals with legitimate claims now have found that their benefits are in jeopardy. And again, sometimes identity theft starts with a Social Security number, a Medicare number. You really want to do all that you can to make sure your information is safe and will not be used to perpetrate fraud. And what is one way that we can help to protect our information? Well, we have these 3 important cards here that we frequently have in our wallet, and so let's share some information about these. Again, it's always important to guard your Medicare card, your number, your credit cards, and your Social Security number. These are a gateway to your identity. To fraudsters, personal information is a commodity that they try to steal from you and then sell to others to perpetrate more fraud. So scammers can use your Medicare number to bill Medicare for products or services that are either non-existent or unnecessary. And so we advise, please, Do not share your Medicare number with anyone who contacts you. In fact, one thing that you could consider is to make a copy of your Medicare card. On the copy, cross off the number. Carry that card in your wallet so that the number is not visible. You can keep the original card in a safe place at home. Please do not sign blank medical or insurance forms. Only give your Medicare number to actual Medicare providers with whom you work, pharmacists, primary care, doctors, specialists, that sort of thing. Please do not share it with anyone who contacts you. Numbers can be spoofed by telephone or by email. If you think there's a possibility someone requesting this information is legitimate, you should call them back at a number you know is correct, and you can share it then. I also want to mention that there have been a number of cases of fraud where people are told there's a problem with Social Security or with Medicare, and they owe some sort of money, or otherwise their account will be closed or interrupted at least. And so I want to mention, if ever you are advised that you need to send a gift card to pay any sort of a fine or to pay for a refund or something, gift cards are never something that would be requested by a legitimate organization. It's fraud. Hang up your phone. Just delete the information if it's a text or an email. You may recall that when we started, we said one thing that we would do is learn ways that we can protect ourselves, and then also how can we detect if maybe we are a victim of fraud. Well, this slide gives us some information about things that will draw our attention. There'll be red flags if we see something wrong with any of these things. So one is we want to keep a record of our appointment dates. You want to know when you went to the doctor, who did you see, were you given any tests, did you need to purchase additional equipment. Keep track of all those things so that if you get a bill for something that is outside of your known dates, that you will know that something is amiss and you need to investigate. We request please review your Medicare summary notices, your explanation of benefits, and any credit card statements for accuracy as well. If you have questions about something you were billed for, it doesn't seem right, you can always check with your provider. Again, sometimes it's a mistake. There was just some sort of a coding error. If you have an Advantage plan, you can check with the Advantage plan as well. However, also know that the Senior Medicare Patrol, which is part of the Office of the Insurance Commissioner and SHIBA, is here to help you if you have any concerns about your medical billing. So you want to keep track of all call details, and then you will be much better prepared if something comes along that doesn't seem right. If there is a problem with the bill, no one other than you is going to be aware of it, recognize it, and will have the authority to contact the providers involved and to get it corrected. So we ask that you please, again, review your statements, your bills, make sure everything looks correct. If something doesn't seem right, you can contact the healthcare provider, question the charge. If it was a mistake, they can correct it. If it appears that there's a problem, you see something on your summary notice or the explanation of benefits that's really out of the ordinary, you're not getting a good explanation from your provider, please contact SHIBA, and we will work closely with the Senior Medicare Patrol so that the problem can be addressed and corrected as appropriate. The Washington State Office of the Insurance Commissioner has put together a really wonderful tip sheet on COVID-19 scams, and it is available. You can get it online at the Office of the Insurance Commissioner's website. We hope that you will check this out because it covers all kinds of things. It's kept up to date, and we want to make sure that everyone stays safe until we get on the other side of this. And again, we'll have contact with those sources soon. So now that we've talked about various kinds of fraud, you know how to detect it. Well, what do you do now if you find something's happening? How do you take care of reporting it? Well, the key to a good report about suspected fraud is to get as many facts as possible and then report the issue, make a complaint to the entity that can do something about it. And so to just kind of cut to the chase and get you connected to the right organization quickly, here are 4 that can help in these instances. Anything related to Medicare fraud can be reported to SHIBA and the Senior Medicare Patrol. both of which are programs of the Office of the Insurance Commissioner. You can also, here on Whidbey Island, contact Island Senior Resources, and one of us will get back to you and take your report. And I'm going to give information about contacting Island Senior Resources in just a moment. The Washington State Office of the Attorney General is where you would go for anything regarding a business. For example, maybe you placed an order for something online that didn't show up or it wasn't as promised. Again, beware of those that are connected with social media. They have the worst reputation at this time. But anything like that gets reported to the Attorney General's office. Unfortunately, whenever there's any sort of natural disaster, there are also scams related to charities trying to play on our heartstrings, get us to contribute. And there can be a variety of charities that really do deliver quality services, but some are scams. You can always check with the Secretary of State's office. They can let you know if a charity is legitimate. They can also let you know how much of what gets collected actually goes to the cause. Sometimes scammers will call you, they will spoof their numbers or their email addresses to look as if they are legitimate charities. Please check out in advance before you give any money. Make sure that you are dealing with the actual entity. We suggest use a credit card for things like that because you can always dispute the charges. Again, please do not do not be convinced that you need to get a gift card to pay for something. And the very good resource for all of us here in Washington State is connected with the State of Washington's coronavirus hotline. You see a telephone number there, 800-525-0127. You can contact them. They're open 7 days a week, and they will get you connected to the service that best meets your need. It's been confusing knowing where to go to find a vaccine. Again, as of the time that I'm making this recording, which is mid-March, things seem to be getting better, and there are more organizations, more locations that are distributing vaccines. But if you have a question about where you can go, there is a website that will help you identify by county the places that are available to you. And you can log on to this website. You can then find locations near you, hours, and register to receive a vaccine. I will be in a moment sharing information again about Island Senior Resources, which can provide direct information for people who are on Whidbey Island. And as promised, for those of us who reside here on beautiful Whidbey Island, and Camino Island too, I'd like to refer you to Island Senior Resources. They really are our one-stop shop for any programs related to older people, people with disabilities. There is family caregiver support. There are workers who are specialists, our liaisons with DSHS, and it's possible for you to get any information that you might need regarding services available, as I said, for people who are older or who have disabilities. Their phone number there, 360-321-1600. And if you hit extension 0, you will be connected with the receptionist. These folks are also our sponsors in the SHIBA program, and so you can call and leave a message for us, and we will get back to you. Appointments can be set up for one-on-one consultations, and then we also do a number of Zoom presentations where we talk about Medicare, how to enroll, that sort of thing. So I hope that this has been helpful to you, and I look forward to hearing from you in the future.